Well-being. Being well. Jealousy. Jealousy is a complex emotional response that arises when an individual perceives a threat to a valued relationship, role, or sense of belonging. It involves an interplay of cognitive appraisal, emotional reaction, physiological arousal, and behavioral impulses. While jealousy is a common and evolutionarily adaptive emotion linked to attachment and social bonding, unmanaged or chronic jealousy can undermine psychological well-being and relational stability. From a psychological perspective, jealousy is rooted in cognitive appraisal processes. Individuals assess situations for potential threats, often engaging in comparison with perceived rivals. These appraisals are frequently accompanied by insecurity, fear of loss, and concerns about adequacy or worthiness. Emotionally, jealousy may manifest as anger, resentment, sadness, anxiety, or possessiveness, reflecting both perceived threat and attachment needs. The intensity of jealousy is strongly influenced by underlying beliefs about self-worth, trust, and relational security. Physiologically, jealousy activates stress-related systems within the body. The sympathetic nervous system may become engaged, producing responses similar to those seen in fear or anxiety, such as increased heart rate, muscle tension, sweating, and heightened arousal. Stress hormones, including adrenaline and cortisol, contribute to this activation and prepare the body to respond to perceived social threat. Hormones associated with attachment, such as oxytocin, may also be involved, influencing feelings of closeness, vigilance, and possessiveness. Neurologically, jealousy engages brain regions involved in emotional processing, threat detection, self-regulation, and social pain. The amygdala plays a central role in detecting perceived relational threats and amplifying emotional responses. The prefrontal cortex contributes to impulse control, reflection, and regulation of emotional reactions, while the anterior cingulate cortex is involved in monitoring social rejection and emotional distress. The insula supports awareness of internal bodily states and contributes to the visceral experience of jealousy. Together, these regions shape both the intensity and expression of jealous responses. Managing and overcoming jealousy involves developing insight, regulation skills, and relational clarity. Self-reflection is a critical first step, allowing individuals to identify underlying fears, attachment patterns, and assumptions driving jealous reactions. Cognitive restructuring helps challenge distorted beliefs, such as catastrophizing or mind reading, and replace them with more balanced and evidence-based interpretations. Strengthening self-esteem and self-worth reduces dependence on external validation and decreases vulnerability to jealousy. Communication and relationship-focused strategies further support jealousy regulation. Open and respectful dialogue about concerns, boundaries, and expectations can reduce uncertainty and foster trust. Consistent, transparent behavior within relationships reinforces emotional safety and mitigates fear-based interpretations. Establishing and respecting boundaries helps prevent jealousy from escalating into controlling or intrusive behaviors. Stress management and emotional regulation techniques are also essential. Mindfulness practices support present-moment awareness and reduce reactive responses, while relaxation strategies such as deep breathing or progressive muscle relaxation help regulate physiological arousal. Regular physical activity contributes to mood stability and stress reduction, supporting overall emotional balance. Adequate nutrition and sleep further stabilize emotional and cognitive functioning. Professional support may be beneficial when jealousy is persistent, intense, or linked to past trauma or attachment insecurity. Therapeutic approaches can help individuals explore the roots of jealousy, develop healthier coping strategies, and strengthen emotional regulation. Support groups may also provide normalization and shared learning opportunities. Jealousy is best understood as an emotion that signals unmet needs, fears, or vulnerabilities rather than a personal failing. When approached with awareness, self-compassion, and intentional regulation, jealousy can become an opportunity for personal growth, improved communication, and stronger relational security. Through psychological insight, emotional regulation, and supportive relationships, individuals can reduce the disruptive impact of jealousy and cultivate healthier, more trusting connections.